All right, part two, delivery of this Maryland bridge. What I'm doing here is just using a diamond burr to deepithelialize the site. I am not shaping the tissue, I'm just deepithelializing it. A little microblade to release our tissue. This is right at the palatal crestal line angle. I've created another little vertical line right in the middle of the crest. I think it's either Norre or Van Doren described this around implants to help release the tissue and let it heal around an implant site. You can do it for tooth-borne as well. It's a little seating jig we made before the patient arrived. This is to help us exert pressure on the Maryland bridge to ensure that it's seating in the correct vertical position. Otherwise, it will tend to kind of float around a little bit. So these seating jigs really help not have to worry about the correct positioning while you're trying to seat in a site that is not fully isolated. I am not good enough to do this with a rubber dam as much as I like rubber dams. I know some people probably can. I cannot. So this helps me do this efficiently without worrying about a malposition. You're seeing me using a little epi pellet. It's a cotton pellet impregnated with epinephrine. It helps control the bleeding. And I'm also using lidocaine 1 to 50,000 epi. So the epi is really useful to help control hemostasis, which obviously helps with their bonding, isolation for bonding. Then the bonding proceeds as normal. Air abrasion, little Teflon tape, make sure we're not adhering to the adjacent teeth. There is my lido with the 1 to 50,000 epi, and then just normal etch and bond. I have air braided the intaglio of the wing on the Maryland bridge, and then I've used an MDP containing primer. It's the normal bonding process of zirconia that Marcus Blotz has described. Here's our little seating jig helping us seat fully. You can see there is some heme interproximally. It is not on the palatal side. Curing it pretty quickly. And then once it's cured, you will see the seating jig seats back where it needs to be. So everything is in the correct place. You can confirm it in that way. And then the rest is just positioning the flap. I laid that vertical incision in case I wanted to move it towards into the interproximals to help the papillas, but because we have adjacent teeth, I'm actually not too concerned about the papillas, so I ended up placing a sling suture here to help keep the tissue towards the buccal, which is really where I need it more so than the interproximal. So really basic 6/0 sling suture around the flap that we laid, and that's really it. This is a 1 hour appointment after we did the shade check, and here we go. There's the tissue that's going to heal for 2 weeks.